MyMichigan Health is stepping up enforcement of their visitor policy to try to stop the spread of influenza-like illnesses. According to the CDC, visits for the flu are the highest they have been in Michigan in the last 15 years. Our David Sackrider spoke with their chief medical officer about the decision and shows us how the flu is impacting the Midland Hospital.
The chief medical officer for MyMichigan Health says they are not changing their visitor policy, just enforcing it, trying to protect both those in the hospital and those visitors from a flu season that's the worst in 15 years.
Given the current flu levels, the infection rates that we're seeing, and then just some of the severity of illness, we did take a look at, do we need to modify the policy? And the answer was no, but we did decide that we just want to re-educate the community that we have a visitor policy.
That visitor policy generally keeps it to 2 visitors per admitted patient and 1 visitor per emergency department patient. Dr. Paul Berg says they came to the decision to more strictly enforce it after state data showed visits for flu-like illnesses was 4 times what is expected this time of year.
So in a 1-week snapshot, we tested 1,700 patients. 28% of them tested positive for the flu. Compare that to just 4 weeks ago in late January, and our testing rate was 12%.
While many think of the flu as a mild illness, Dr. Berg says catching it can become much more serious.
Yeah, just in the last several weeks, we've had 4 serious illnesses just in Midland, cardiac events that happened in patients that were caused by influenza.
He stresses the importance of getting a flu vaccine, not just to protect yourself, but to halt the spread of the illness.
We give it through April. So even though right now we're kind of peak flu season, if you're not vaccinated, it's never too late.
For more information about how to protect your family from the flu, you can find a link attached to the story on abc12.com. In Midland, David Sackrider, ABC 12 News.